My name is Aurora Martin, and I'm the co-director of Front and Centered as people are coming in. But really, the show begins when Miss Ruby Love, our MC, actually frames our conversation about the Frontline Response Fund, as well as the series on our um, frontline voices from the field, essentially, about COVID and what our community groups have been doing in the last year, really, to cope with and really pivot from the mission and the important work that they all have been doing to really be all hands on deck with regard to this emergency situation. We've also got an uplifting, very hopeful video that we would like to share as well in just a bit. Ruby, do you want to take it away?
Yes, I would love to do that. Welcome, everybody. It's great to see so many friendly faces, and happy Friday. Yeah, there's a couple of people are dancing on screen. So my name is Ruby Love. I am organizational strategist and work on fundraising at Front and Center. And this, you have joined part 3 of a 3-part series that we have been hosting on the COVID-19 Frontline Response Fund. And we have been interacting and hosting professionals and experts from the field as it relates to health services, both in public health, physicians, researchers, social work, and those who are now at the point of actually being able to work with people on the ground in getting vaccines into arms. And so I'm really happy that we have the team that we've got today. I want to give you just a little bit of background real quickly. And some of you, by the way, I know are donors to the Frontline Response Fund, so I want to say thank you for that. The Frontline Response Fund was created at the outset of the COVID-19 pandemic here in Washington State. And our effort was to essentially pivot from the work that we were doing around climate and environmental justice specifically, and add the health issues that have come from the disparities that we've been experiencing with COVID-19. Very quickly, we were able to raise dollars and put them directly into the hands of our member organizations, of which there are over 75. And the amount of money was a little over $500,000 that went to our organizations. And now we are in the second phase of that effort. And this is really to make sure that those organizations now are working on helping our people receive the vaccine and also lower the anxiety, the mistrust, the questions that people have about the vaccines that are becoming more and more available in our state. So that's a little bit of background about what has happened to this point. And we want you to continue to spread the word, those of you who are on this call, about how important it is for all of us to, in some way, participate in the Frontline Response Fund, if at all possible. I am really happy that today we are joined by Victor Rodriguez, who is with the Tacoma County, and Pierce County Public Health Department. Mia McFarland, who is with the Pacific Islander Health Board, and Dr. Cristina Toledo Cornell, who is a physician with the Lummi Tribal Health Center. And together we will have a discussion with them about their roles in the COVID-19 response. And then following that discussion, we will have an opportunity for you to ask as many questions as you possibly can. We also have a special guest with us, and that is Sidonia. And Sidonia is with the Tacoma Ministerial Alliance, and she has recently orchestrated a number of pop-ups in, she's administered one pop-up and is scheduling another one in Tacoma, and she is going to share a bit about that, Sidonia Young, so we'll introduce her a little bit later. I would like to now have our Zoom Jay go ahead and run our Channel 5 program.
Thanks, Ruby. So, bonjour, my name is Bridget Ray. I am a Director of Strategic Partnerships at the Na'a Fund. I'm a mixed Native woman of Turtle Mountain Chippewa descent, living in the traditional territory of the Squaxin Island folks, Stachas, otherwise known as Olympia. But today I'm zooming in from the area of the Umpqua in their Umpqua Business Center, which they were gracious enough to lend to me for a couple hours. I have had some technical difficulties today, but it's Friday, it's sunny, and we're all together in this place. And we're going to make it work. And I'm so excited to talk to the panelists we have today. Victor, Mia, and Cristina and Sidonia have all been doing some very important work. And we're just going to kick it off with each one of them introducing themselves. And we'll go in that order. Victor, and then Mia, and then Cristina and Sidonia, if we can. All right, we also have a video to show later, and Victor's ready. If Victor's muted, we should unmute.
Okay, looks we're good to go. Thank you so much for the introduction, and thank you so much for inviting me. It's an honor and privilege to be able to present and along these amazing people here, and then being able to talk about such an important topic right now. My name is Victor Rodriguez, and I work at the Tacoma Pierce County Health Department. I am the equity manager there for the health department, currently serving as our health department's equity officer. I lead our community engagement team that's focused on engaging people that are disproportionately impacted by COVID-19 and ensuring equitable access to information. And right now, obviously, our focus is vaccination. And yeah, I look forward to the discussion to talk about, what this means for BIPOC communities and low-income communities and how we can work together to make sure we protect our communities. So thanks for the invitation. I look forward to the discussion.
There we go. I've just gotten unmuted. Thank you, Bridget, and then thank you everybody at Front and Centered for inviting me. My name is Mia McFarland. I'm with the Pacific Islander Health Board. I was originally hired on to do outreach work for our King County Best Starts for Kids grant, but my position has completely shifted into everything COVID and like 10% actual grant work. And so the Pacific Islander Health Board does a lot of education, outreach, and advocacy for the Pacific Islander community throughout Washington. And we've been fortunate enough to work a little bit with Front and Centered. And actually, it's funny how I got connected. I had applied for the COVID grant that Front and Centered was providing and had given them like our admin email and hadn't been checking the admin email. And poor Melina calls me and she goes, "You still want this money, right?" And I was like, "Oh my God, yeah." So I'm really glad for this connection, and it's been a joy.
Hi, everyone. Thank you very much for having me here today with everyone. My name is Cristina Toledo Cornell. I'm a physician and I'm the public health director here at the Lummi Tribal Health Center. I have been running their COVID response team for this past year. And my job is really focused on protecting the community from any communicable disease, but now COVID being a big part of it. We do everything very much like you would expect from, for example, the Pierce County Public Health Department, where we track disease, we have data, we collect, we quarantine, we test, we do pretty extensive and have significant wraparound service for our community. So that's what I do here and work with a big team. And have been involved from the very beginning on basically getting the community ready for when we have vaccinations, including we're running our own clinical trial here, one of the COVID vaccines. So it's really exciting to be here, and thanks for having me today.
Is Sidonia with us?
Hello, I'm having some challenges with my audio today, and can you hear me now?
We can, thank you.
The video is completely off, so I apologize for that. I was just so excited to talk to you all about what we're doing in Tacoma Pierce County. I'm with the Tacoma Ministerial Alliance, and what our goal was this year is to be involved in helping the city and the county in terms of reaching those individuals that traditionally cannot be reached for the vaccine, and also educating our community. And being a community of color on the hilltop, and somewhere probably in central Tacoma and some of the other areas, we find that the communication was not getting out to everyone. And also we needed an education, a real push to educate our community members. And we believe that through the churches, we would be able to contact more people, also those that were did not have access to transportation or really means of communicating to us what their needs are. So we did receive a $3,000 grant from Front and Center, and we are so pleased with the outcome. We did do a pop-up in April, and it was so successful. I think it was on King 5 and some of the other news papers did have some really excellent people coming out to identify issues and work with us. We are looking at doing 3 more pop-ups, looking at how we can involve the educational system, including schools and so forth, making sure that the teachers and also the students in our community have the vaccine or have a place available for them to get vaccinated. I think one of our most exciting part about that is that we had the NAACP and our youth committee group get involved, and they went from house to house, providing information, resources, and setting people up to get vaccinated. So we had our first one, like I said, in April, and we had almost 300 people attending that session. So that was really great. The mayor showed up, and she was also pleased, and we will be receiving some additional funds, which we are going to be utilizing and reaching out further. Really, we're looking specifically for those individuals of color, those elderly who are in homes that perhaps don't have access to transportation. And we're looking to the youth to provide some leadership in educating those college students and high school students about the need to get vaccinated.
Awesome. Wow, Sidonia, that's a lot. Thank you for sharing that with us. We have some questions for the panel today, but first we're going to watch a video.
You know, what I would suggest is that we actually, in the interest of time, we're going to have to wind up that video so that we can make sure the technical aspects can be worked out, but we can show that the amazing progress that Sidonia and her team at Tacoma Ministerial Alliance are heading up, and we'll end on a positive, uplifting note with that video. So we can go back to the panel discussion, Bridget.
Okay, very good. We can also drop the link to the video if people want to watch it later. And it's quite something, so I hope we can get to see that. Today, the first question that we're going to lead off with is what policies are being implemented on the ground to address disparities of vaccine and health access? What is the equity issue for the work that you're doing? And I think we will start with Mia and go to Cristina and then end with Victor.
Thank you. I'm sure Victor can talk about this a little bit better, but I think one of the policies that we always advocate for on the vaccine side, just because at the beginning there were so many barriers to finding an appointment, starting with even the technology use of it all, having to go onto a website and find that appointment yourself was such a barrier for our community. And so I've noticed like a lot of health entities now are beginning to have availability to call in and make appointments, or even walk-up clinics for those people. And one of the policies I do really appreciate that a lot of health entities have also put into place right now is just low barrier vaccine sites. So all you would need is your name, a date of birth, and an email to make sure that you can get those appointments scheduled. And so that was very helpful. And especially on our side, when there's so many community members who don't have insurance and are really concerned, like that was something we had to tackle at the very beginning, was the insurance portion, because people didn't understand that the shot would be free no matter what, even if you didn't have insurance. So they would call me and they'd be like, "Oh, I can't get the shot, I don't have insurance." And I'm like, that's wrong. So I'm glad they're kind of shifting that narrative to where everybody can access it, and those low barrier sites have been really great. But I will pass it to Cristina.
Thank you. At the very beginning, I think the biggest issue that we had was actually the number of vaccines. Being in a tribal center, we have a pretty universal healthcare system where we run a lot of the service ourselves. So in terms of access, I think the community have pretty good access. And there is never insurance concerns. People always know that whatever service they get here is free of charge. But once we got more vaccines that became less of a problem. I can tell you, for example, that at the very beginning, when we only had a handful of vaccines, we're getting like 300 or sometimes 100 at a time. We really prioritize those people high risk. We made sure we called them and we got them in, arranged transport if we had it too. So that was pretty easy. But once we start getting large amount of vaccines, which has been happening since probably mid-January or so, we had just had large community events where it's open walk-ins. People don't have to schedule, they just can show up. Which is great for the vast majority of people. But then there is a small percentage of people that has a lot more either barriers or perceived barriers that keep them from coming. So that really has been what we have been focused on a lot more recently, and devising incentives for people, opportunities for people to ask questions about their vaccine, express their concerns, their fears, and things that they feel that will keep them from getting vaccinated. So there's a lot more sort of small steps and more frequent steps that you have to take. It's not just having the vaccine, having the place to get the vaccine, but really getting people there. I can tell you, for example, that with the elder community, we had great success. My assumption is that at this point, we probably have vaccinated more than 90% of our elders here. And probably the other 10% that perhaps we don't know if they have gotten a vaccine yet. It's just there isn't a way to really see people who get vaccinated somewhere else. If they're getting IHS vaccines, for example, we only can see whoever we vaccinated here at the clinic. So that part of the data is a little misleading. We have just trying to be keeping track of those individuals by calling them, said, hey, did you get your vaccine? If not, then please come, we have this day. So I think we have had phenomenal success with the older individuals. The younger community, that's the one that's been a little more challenging to get them in, especially in the 30 to 40, 20 to 40 probably, and even the teenagers, because Lummi has had the capacity to open up vaccinations to everyone since probably the last week of January, once we had more vaccines and we could just get as many people in as we could. So those people take a little more work to get them in. Last week, we did a community-only event. The tribe approved to get special salmon meal for whoever showed up, T-shirts, gifts, that kind of thing, to really encourage people to get that vaccine done. So we still have quite a bit of those people that are not vaccinated, but I think we're making some good progress. But I wanted to tell everybody that it has taken a very long time, actually, why we are where we are today. We have been talking about vaccinations since since May last year, because we start talking about running a clinical trial here. So we talk about vaccines a lot with the community, what that means for them, and why we think that was important that Native people should be vaccinated. Because when we really look at health disparities, we're not just looking at COVID and actually vaccination. We're looking of years and years of health disparities, right? We have communities, which I'm from Brazil. I'm one of 10 kids, and I grew up in a household with a lot of people, right? So I really find myself connected to the Lummi community because we have really large households, we have multi-generational families, but at the same time is all the things that made this community high risk for COVID because of all those issues, which I think baseline is wonderful to have all those people live in the same house, but once we have a communicable disease, it becomes a much bigger problem, much more difficult to control the spread of disease. We did phenomenally well until sort of this last big, huge wave that really hit our community really hard. We went from having about 150 cases the whole year to going to 500 cases in just a period of less than a month or so. So it's really a really big input. We lost 3 community members. We hadn't lost anybody. We had worked really hard to keep our numbers as low as possible. So I think they took a lot of work to really preparing people for the vaccine, but at the same time, we have to realize in the long term, even beyond COVID, is to really address those issues.
Everyone, sorry, I had to walk away, charge my computer, was about to die. Yeah, some of the local policies at the Tacoma Pierce County that we've been trying to implement to try to address this vaccine access and healthcare access. So some, like for example, in our health department, the equity officer role, right, actually wasn't a thing prior to this pandemic, right? So anytime there was a public emergency, there wasn't like an intentional person or people who were looking within the response to make sure that there was equity was considered and incorporated into how the response was made. And then also too, we stood up a community engagement team that is very focused on engaging communities that are being disproportionately impacted by COVID-19. Again, this is a new thing for our health department. In the past, we had like broad community engagement like section that engaged like the schools and like stuff like that. But our team is specifically focused on communities that are being disproportionately impacted by COVID-19. And then, so those were kind of two early on. And then another early on kind of policy was on language access, making sure that our information is culturally grounded and people have access to it. And so that has looked like translating our website into Spanish. We have a website with a library of resources with multiple languages. I know King County has an amazing also library on their website. And so we kind of also learned from them as well about, translation, but that was a big piece, translation. I would say though, we still have some growth to do so that it becomes more like an automatic thing that things are translated and we're not waiting for community members to say, or for like community engagement staff to request it. That is just part of the way we do business. But that was another one. And then part of that communications, we invested about $1 million over the summer to implement what we called culturally grounded communications and community engagement, which was essentially funding organizations, community-based organizations to do outreach in their own communities and their own languages, using their own cultural kind of frames to talk about vaccine and everything that's surrounded, or COVID and everything that's surrounded by it. So that was another thing, is just investing in those organizations as well. More focused on the vaccine, as you know, early on, there was obviously still limited supply. So we, over the summer also, or the fall, we also conducted a health equity assessment. When we spoke to over 200 people that were affected by this, right, to learn about what their needs are and about, who's being most affected. And based on that, we kind of set our focus for vaccination. And early on, we tried a couple of things. Number one, the first thing we did is we tried to do as much communication to the community as we could. But what we found is that the appointments would fill up like in 2 hours. And the majority of the people who were signing up were white folks. So we tried a different route, right? So we said, okay, and that's actually kind of what we're doing now, is we're not promoting some of our focus clinics to the whole public. We only share it to our network of organizations that we work with, right? And even then, we're still seeing trouble getting people vaccinated, but we don't put it on our website, or no, we don't put it like on our social media, stuff like that, right? We sent the link for registration only to the specific folks that we're working with through our Equity Action Network. So that seems to help a lot more. We're seeing, more vaccination, but it's still not enough. We're still not seeing the kind of rates that we want to see in terms of vaccination. And then the others include like the pop-up clinic that we saw earlier, right? That we talked about earlier, which is, working with community partners to identify a site. And we basically go there, we go there, and the hosting organization, they engage their people, their network, they provide a space, right? And the health department goes and does the vaccination. But there's just a couple of some of the policies that we've tried to implement. Unfortunately, if we look at our data, we're still seeing that the rates of vaccination among Black and African American, Latinx, and Pacific Islander community in Pierce County, and I'm make the assumption it's probably true across the state, is not at the rate that it should be. So we still have some work to do.
I have a follow-up question. Thank you all for your really great answers. A lot to think about. Questions are pouring in via the chat. We'll get to those just a sec. But Victor, you also co-chaired the Environmental Justice Task Force for the governor's office, and some of that work was identifying those problem zones. And you had mentioned that there was a health equity assessment, which is getting the information of where the issue is and then having a response to it. A lot of people are concerned with what do we learn from this time around to prepare for the inevitable future of other pandemics and other environmental factors such as smoke and fires that will make the pandemics worse. And so how do we prepare? And then once we get there, how do we adequately respond for our communities in the future? It seems like that environmental task force established a health disparities map that would help with that information planning for the future. And so I'm wondering if you used any of that information in your health assessment and in your deployment of your pop-up clinics from the map.
Yeah, we and just to clarify, the task force itself didn't need to create the map, but definitely promoted it as an important tool to incorporate environmental justice into state government. And I don't know if how much folks know, but there is some research that correlates pollution with higher rates of COVID-19, particularly like air pollution, right? So areas that are more concentrated with air pollution are seeing higher rates of COVID. And of course, we know that people of color are more likely to be living in areas that are more polluted. So there's that we definitely face that issue. And I think that the lesson I think that we could take is that one of many lessons is a reminder that our health is deeply connected to the health of the entire community. Right, like the kind of standard mainstream kind of American dream kind of story that we're all individuals and that we all should just work hard and do your own thing, right? And that we should all just kind of fend for ourselves, right? And the free market is counter to what we need to address public health crises like COVID-19. So I think that's one, right? Everyone needs to recognize that we're all interconnected. Our health is interconnected. So, and I think the second thing that I would say is that this is a glimpse of what we expect with climate change on the horizon. We're going to see the exact same thing that happened now. And so as community-based organizations and as people doing equity work, I think we really have to elevate and sound the alarm of what's coming. We saw this pandemic hit all those that are already struggling, and a lot of community members, organizers have been saying that all along, that when we have these big crises, those that are really struggling are going to be hit the hardest. And that's exactly what we're seeing with COVID-19. Right. So I think that we have to, kind of take this lesson from this crisis and apply it to our environmental justice work and to really push government to set up the proper measures to ensure that when we do have these kind of public health kind of crises, right, that we have the infrastructure in place to be able to protect all people and communities.
Bridget,
Hey, Bridget, you're on mute.
Unmute. Somebody should unmute me when I do that. Me and the mute button have like this ongoing. I was trying to read from the chat, so let's go back to that. What we have some questions. We've pretty much touched on the 3 questions we had, and so I'd like to enter into the conversation more with some specific questions. There's a question for Mia, and there's questions in general about how our communities are experiencing higher rates of exposure. And I'd like to give some space for each of you to answer that. This one's specifically for Mia. Pacific Islanders were also experiencing some of the largest rates of exposure. And what are some insights about the barriers and progress today? Mia, if you could. Yeah.
That's a great question. Yeah, there was actually a couple news stories that I did not love that came out towards the beginning of the pandemic where they had interviewed people within our community and they said, oh, it's because the reason our rates are so high is because we don't know how to not hang out. And I was like, no, like, please don't spread that narrative. Like, that's part of it, sure, but that's a part of every community. And we're seeing that in every community where it's hard. Like, I have friends who still spend quite a bit of time together. Like, I haven't seen my friends in months though. So I was like, that's not the narrative I want to spread. But what I would like to say to that is that, like, there are so many reasons. A lot of it is like we have so many essential workers who go into work and get infected, bring it home to then a multi-generational house with grandparents or younger kids. And then everybody in the household then has it and might possibly not know and then spread it some more to other Pacific Islanders. And so that's been part of the story, like the multi-generational housing. Like, I live with a ton of family, and like that was something we were concerned about, is because we had essential workers going out to work and coming home. And there was a lot of risk there. And like, I specifically was going out into community to provide services during the pandemic. And I was like, well, like, we had plans in place to quarantine in different parts of the house, but some people don't even have that luxury where there's so many people living at home. Like, there's nowhere to go for quarantine, and so much misinformation going around about the coronavirus in general. And people don't know like what resources were out there. Like, I know a lot of counties had funds for people in quarantine or quarantine sites that they could go to, but our community didn't necessarily know how to access those sort of services. And so I think there's a lot of layers to it. And I think one of the biggest challenges too is like we struggled with translation needs a lot. At the beginning of the pandemic, we asked the Washington State Department of Health for funding for translation, and they rejected our request and said, nope, sorry. Like, we'll figure it out on our own. And that's like still an ongoing fight with them. Pierce County's been really great about that. King County hired on some of our translators to do that work. So we've kind of picked up on that, but see, things weren't coming out in translated languages. So if you're sending out a bunch of information about coronavirus and how to stay safe and all of that in English, like, there's so many community members that won't understand and just won't have access to those resources like everybody else. And so, you know, there's been a lot of layers to it, and I think we're still seeing those high rates. And it's been a challenge, honestly, to get people vaccinated at the rates that I think would be helpful to our community, because our coronavirus rates are still pretty high. But there's so many community members interested in vaccine. It's just been an access issue at this point. Like, I was telling people a couple days ago, like, it was impossible to find appointments at the beginning when our elders were eligible, and then elders don't have technology like a lot of us young people do, and they don't know how to get on the cell phone and find those appointments. And so I very literally was calling elders, getting their names and like dates of birth and addresses, and then signing them up for appointments on my side, and then calling them back and saying, here's your appointment, here's the address, like please show up.
Right.
Or like if you need help, like I'll take you. But so there's just a lot going on, I think, in the community. And it's been challenging. It's gotten a lot better. I think a lot of people have gotten a lot better about it, but yeah, it's a lot of layers.
Still, I think our communities, as wide and diverse as they are, we all had a common effort of getting our elders and our at-risk members in metropolitan areas, in rural areas, and on the reservation. Overall, we had a better effort than most. And even though there were less vaccines on the reservations and better communication, more vaccines in the populated areas, but not as much education, or maybe language and technology was a barrier. I'm just absolutely convinced that we were out in front with the outreach effort. So thanks for Mia for that answer. We've got a whole bunch of questions that are just racking up. People have a huge curiosity, and the next one is for Cristina, and about vaccines and incentives. People are wondering about the difference between vaccination efforts between the metropolitan areas and King County, Tacoma, Pierce versus rural and reservation. And I would just like to get Dr. Cristina's viewpoint on how the vaccination was different at Lummi versus maybe the Indian Health Board or the clinics that are closer to metropolitan areas.
That's a great question. I don't know so much how the urban areas are doing with vaccinating Native people. What I can tell you is in general is that some of the struggles that people here had is similar to what people live in big cities have, is transportation, for example, access to information, access to the internet, reliable way of getting to know where things are happening. A lot of older people, for example, have no idea how to use the internet to get those appointments done. So if that's the only way that people are doing, you're going to miss a lot of people. So we have, from the very beginning, I think a good understanding of what the challenge of your community is. It really helps you sort of tackle some of those issues. For example, allowing people to call in, as some of the panelists were talking about, and walk-ins, just people can come. The one thing that we have been doing is set up a transport person on the days that we have the COVID drives, and then we'll be calling people and said, hey, we're doing this today. Can you get yourself there? If not, we can set you up with the driver to get you there, because that transportation is a big issue. Some people don't have a driver's license, or they don't have a car. So I think that those are similar questions and similar problems everywhere. I work in Boston in the poor community, and a lot of those issues were present there. So I think that it has to be a concerted effort and to understand all those different barriers and trying to put that as part of your planning, so that once those problems come up, people can get transport. I know a lot of big cities are doing those mass vaccination centers, which sometimes makes it easy for people to just go because they know where it's happening. But again, if those are far away from where the vast majority of people live, particularly people of color that tends to live in more with poor transport, that's a big barrier for a lot of people. So those are considerations that people have to have and really target those communities as best as they can.
All right. Well, thank you. Yeah, I think many of the questions that are rolling through are about how do we get our community members who have those barriers or experience those barriers to overcome but mainly their fear. How do we, so this is a question for Sidonia and perhaps Sidonia and Victor. There are a lot of non-English speaking elders living in public housing in Pierce County and King County. And rather than calling for appointments where they, might get the runaround on a phone system or not get in touch with someone or understand, what about, why not prioritize mobile sites at those housing areas for those elderly who might have the language barriers? And Sidonia, if you're there, I'd like to start with you, give you some space, and then move to Victor.
Well, we work with the Tacoma Housing Authority and also the Hilltop community in terms of the language barriers, and they did a flyer for us in Spanish, and I believe it was one other language, but the major was Spanish, and then we had some Asian and Pacific Islander individuals from other communities helping us with those individuals in our community. I think why we were most successful is because it was kind of like a holistic kind of attack really on the community in terms of being able to assess where are the elderly, what are the language barriers, what are the transportation barriers, what are the communication barriers, and working through different organizations to help us work with that. Specifically in the Black community, we were really skeptical about, and myself too, about getting the vaccine. I just didn't know enough, and we've been, fooled before, and we've been used, tested everything. So what we did is that each of the churches took it upon themselves to have meetings with their church members and church leadership within their different areas and talk about it. They had video showed, the health department came out about 3 times and talked with church members, different groups, Masons and all those groups to really get their questions and answer their questions. And we just didn't look at the seniors, we looked at the youth, and the youth providing those resources in terms of transportation and really getting out to explain to other students about why it was important that their family get vaccinated and how it would impact the Black community in terms of us being able to open up if we got our community. And we did look at the churches within Tacoma as the community itself, a greater community. And I found that we really got a lot of help from, I'll have to tell you, front and center. We were looking for a miracle from them, but they came through with us, and that really helped us get our finances together because we were doing it with nothing. The health department said that they were going to provide the vaccine for us, and and we had to get people to register these individuals. We had to get transportation. We did provide incentives for the youth to go out to different communities. They enjoyed it too. So it was really, I think, a whole city effort. We had the mayor involved, and we had the housing authority involved. We had the Hilltop community involved. We had Front and Center involved, and we had all the senior citizen homes around those areas were identified for us to go to. So we kind of made a map, and each person had this area that they would go around and talk to them each day. But I think all the conflicts or challenges that we had, we know that we couldn't meet them, but if we felt like we had at least made some inroads and get people talking about it more, that would be more successful. And with the getting the publicity from some of the newspapers and all the TV stations, that really helped us in terms of looking at again when we have another one, because people are asking, when is the next one? When is the next one? So I think that really worked out. They are challenges, and it takes a lot of resources. And because we have so many churches in Tacoma, which is great. They used to say we had one on every block, but we've got as many as possible in terms of supporting us and being involved in our efforts.
Thank you, Sidonia. Victor, do you have anything you want to say to that?
Oh, just add that the kind of way that we've been approaching that is through working with amazing people like Sidonia and local leaders. You know, they're really the heroes in all this. And like they said, like there's not a whole lot of resources, you know, but that I would say that's a huge piece of it. One thing that we know about just about any sort of behavior change or adopting a new behavior is that the most powerful thing that facilitates that is a trusting relationship. You know, and right now with vaccine, the same concept applies, right? What's going to get someone, for example, from stop smoking, we've kind of seen a lot of research around those things, and what it is this trusting relationship, right? So that's been one way, and then the other is having targeted pop-up clinics in like homes and you know, different areas that are concentrated with elders and seniors, and having local leaders and partners help support like translation, interpretation, and you know, transportation and that sort of thing. And just recently, we invested in another $1 million on this, and we're working with about 12 organizations. We're going to hire community health workers that speak multiple languages, that are from these communities, that can continue to help support elders and other groups who have a difficult time accessing the vaccine clinics. And so we're just wrapping that up now, and we should have those organizations ready to go and start doing work in May.
Well, that's great. Right on. Way to just like, boom. So I have 2 questions left, and then I'm going to hand it back over to Ruby, and we'll see if we can get that video going. And, you know, there's so many other good questions. I want to thank everyone who's put forward a question, and, you know, we'll do the best we can. But I think a nice segue is, are there gaps where government economic support are not reaching donors, that donors should be aware of? Like if we want to invest our time and resources, and as an extension of that question, you know, part of our giving is our time and our ability to advocate for certain policies and actions as well. So not only, you know, money and resources towards places where government economic support isn't happening, but also policies that we can advocate for in the coming months. So again, I want to start with Mia, and then Dr. Christine and Victor and Sidonia. If you could give a brief answer to, you know, what policies or funding gaps are there that, you know, that people could step in and support, you know, in the near future? What can we do right now?
Right, that's a great question. I think the one thing I think about is like there's so many of our grassroots organizations that are doing this work and not necessarily even getting funding for it. I don't think we've received COVID funds for quite a while now. And a lot of the work that we do outside of King County it's funded ironically through King County funds. Don't tell them. But so like we work in Pierce County, Snohomish County, like I've been attending meetings for both using just my regular pay. And so any funding is always good for grassroots organizations doing the work. At the same time too, I think anytime you can share resources, and one of the things that has worked really great for our communities is being able to partner with other organizations. And so like the Pacific Islander Health Board partners with the Asia Pacific Culture Center. And so we'll be able to send our clients, I should say, to them to get vaccinated. And that's a partnership that they're doing with Tacoma Pierce County Public Health. And so that's been a great connection too. And so if there's organizations you work with that, you know, can be connected to community a little bit better, I always recommend helping facilitate those connections.
Awesome, thank you. Doctor?
Thank you. The Lummi Tribal Health Center we have some limitation of how we can use the funds that we have because we're a government organization. So a lot of the funds that we get have some limitations how can it use. But the tribe does have an organization that's called the Lactamish Foundation, which is it's a nonprofit organization. Which is phenomenal. I was just getting an email that they have all kind of prizes for tribal members who haven't got their shots yet to go there and get those, enter in those raffles. So they are an organization that people, if they're interested to donate to, they'll be happy to get those funds, because they really do a lot of outreach, community education, a lot of cultural things, really bringing out elders to talk to the community, and really hearing what people's fears and concerns are. So they're a very important partner that have been working with us during this entire pandemic, supporting our communities when they were in quarantine. We had a lot of people in quarantine. I just look at the numbers. We had over 1,000 people already this year, and we had to be in quarantine. So they need food, they need shelter, they need all those kind of things. So that foundation really helped us with funds that sometimes the monies that we get, that has all kind of limitations how we can utilize. So they really help us of those funds that are more free to be spent that way.
Oh, we love a good tribal foundation too. They're, they are around the Sailor Sea area, and Lummi is just doing a great job with that foundation. Thank you for bringing them up.
Thank you.
Yeah. Victor?
Definitely. I agree with Mia about the in terms of the funding gap. Like really investing in grassroots organizations, I think is a big piece of all this. I think they're going to do the work anyway, right? And so I think that just really investing in that leadership, really investing in those organizations is really important, not just for vaccine right now, but our long-term kind of work to address equity in our communities. So I think that's an important one. I think in terms of policy, I think this is an opportunity for us to really be bold around policy. A lot of people have talked about, like we should all get vaccinated so that we can go back to normal, but that normal is not very good for a lot of our communities, and so I think that we have to really advocate to come back to a new normal, like some of the policies that I can think about that I think would be specific to COVID, but really to a lot of things, universal healthcare. Everyone, doesn't matter where you come from, right? Doesn't matter who you are, you should have access to a doctor, access to a clinic, access to the things you need to protect yourself, right? Another huge gap that we've seen to this pandemic is childcare. Universal childcare. Everyone deserves to have a place to take their kids so they can work, so that kids have a place to go, right? We've seen a huge gap in that as well. Also, the minimum wage. Right? We need to increase the minimum wage so that if people are in a difficult situation, they have money to not just pay the bills, but to make moves, like to respond to crises, right? And so I think that's another big policy that we should be, really pushing for at the state level, even national level.
Yeah.
That's another one. Yeah, and I think the last one that I would say is just around our community health worker infrastructure, right?
Yeah.
I think that we need to, that should be heavily invested in. And that's good for our communities because it creates jobs, for grassroots community members, right? It creates jobs for them, but it also creates obviously bridges between communities and these systems. So I think that's another policy area. And then the last one I would say is around behavioral health. And this is connected, I think, to healthcare access, right? But I think in particular, behavioral health, we really need to expand our behavioral health system to be more than just responding to crisis and more about mental health well-being promotion, right? And healing, right? Because I think right now our mental health system is really focused on like severe mental health crises, right? For in general. And so I think that, this pandemic is having a huge impact on our individual and collective mental well-being. And I think this is a good opportunity to really elevate why it's so important as an ongoing kind of need for a community to be healthy, is this kind of proactive mental well-being kind of resources that people need. And so I think any policies that, promote that would be very good for our communities.
Yeah. You said it. You're on a roll, Victor. We could are you running for office?
Not anytime soon, though.
Okay, can we see the baby?
She's just when I just had I had the moment
Just missed the baby?
and then she just ran off.
Okay, for future conversations. You
All
want
right.
to see, all right, because that's what we're working for, right? So the actions that I heard were to support grassroots organizations. And that's a great place to invest our time and money, and to be bold about policy, universal policies that benefit everyone, like healthcare and childcare and minimum wage, and that we really need to be proactive about our mental health and healing, not just for ourselves, but for our planet and our place in it, you know? So with that, I would like to thank each and every one of you for being here. I'm going to tap Sidonia to see if she'd like to intro this, say a few words before this video, and we're going to roll video, and then Ruby's going to close us out for the day. So panelists, thank you so much. And usually I give everyone a chance to say a few last words, but I really think that this would be, that what you said was very potent and gives us something to do. And so Sidonia, did you have a few words?
I'd like to really thank Victor, because he really has stated a lot of problems that we have and we continue to have if we don't look at our individual grassroots groups and also support our healthcare. And really, we're talking about going back to normal. As Victor said, we've never been at a normal state in the communities of color. And I think that's wonderful. Thank you, Victor, for really echoing those sentiments that we all have within our communities. Talking about the video, this was the one we took at the clinic to show what we're doing, how we're doing it, and showing really the community in Greater Seattle, Tacoma, that we can do it with the help and resources of other large organizations. So thank you all very much.
Can you see this one?
Yes.
Yes, now we can hear you.
The COVID-19 vaccine has come to the hilltop. The Tacoma Pierce County Health Department debuted a new approach to distributing the vaccine today, working with community leaders to set up a pop-up vaccine clinic in one of Tacoma's historic churches. And so far, residents in the hilltop seem to be responding well to the approach.
Everybody was polite. My kind of fear went away, you know, so, and I feel fine. I sat down for like about 15 minutes and I feel fine. I don't feel no symptoms, and I'm getting ready to go home.
The new approach aims to ensure people in communities most likely to be infected with COVID-19 are protected. Some also hope that this can be part of a larger push to restore faith in institutions that some feel has left the communities they're supposed to serve behind.
There is mistrust, and it's a lot of the conversations are about like, how do we make people trust this vaccine? And really, I think it's that we need to focus on making people more trustworthy of a system that's failed them.
City leaders are excited about the new approach and hope this kind of outreach will bring everyone one step closer to the life many want to get back to.
I think this is how we're going to get our community vaccinated. I think, you know, too often we set up clinics and places and have people come to us. When you do it this way, this is why I'm so grateful for our health department, is that they're really looking at, if you want community to get the shot, you don't ask community to come to you, you go where community is.
Now, Tacoma's health department says that this is just the beginning, and they plan on starting more pop-up clinics in different neighborhoods in order to make sure that these marginalized communities are protected from COVID-19. They also understand that there is still some skepticism regarding the vaccine, and they encourage people, if they have any questions, to go to their website or come to one of the pop-up clinics where there will be somebody there to help them in any way possible. For now, we're live in Tacoma. Lionel Donovan, King 5 News. Lionel, thank you.
And for now, we're live virtually on Front and Centered. Back to you, Ruby Love.
There we go. Well, this has been a great afternoon. I want to again thank this amazing panel. I want to say a couple of things. If you've learned nothing else, I hope that you have learned that our people of color communities and the leaders within them are the trusted advisors. and they are exceptional at mobilizing so that the work that needs to happen and the care that needs to be provided actually can occur. And so that's one of the things that we love about working with Front and Centered and with all of you who have joined this call. I think about some of the things that are affecting our communities, from wildfires to asthma, to needing colon screening, to food security and food safety. All of those things are the various kinds of activities that the member organizations of Front and Centered engage in, and you can count on us. And I just was really impressed with the 3-part series of all the various people that we've been able to access to show those of you who are on these various calls that you can count on us, you can look to us. We do have access to the expertise, the talent, and the resources need to come our way so that we can be there for our communities. They actually really trust us, they count on us, and they look to us to be there for them. So this wraps up our session, and I hope that you continue to look to Front and Center as a resource, and there will be more in terms of these kinds of panels in the future on many different topics. Have a wonderful afternoon, and thanks so much.
Thank you.